Up to 90% of people with kidney illness are unaware that they have the condition, which is concerning because kidney disease is silently rising to the top of the global death toll. Because kidney disease progresses slowly and silently, with no outward signs in the early stages, it is frequently referred to as a silent killer. This video explores 8 warning indicators that your kidneys might be pleading for assistance. Keep reading through to the end because I'll give you some easy yet effective advice on how to safeguard these important organs. Located on either side of your lower back, your kidneys are more than just insignificant little bean-shaped organs. In actuality, they serve as the body's natural filter. About 50 liters of blood are filtered by your kidneys each day, which also serve to maintain your general internal balance by eliminating waste and adjusting fluid and electrolyte levels. In addition to eliminating excess uric acid, they also control vital minerals like calcium, salt, potassium, and phosphorus, which are necessary for the healthy operation of your heart, neurons, and muscles. By maintaining fluid balance and producing hormones that regulate the tightening or relaxing of your blood vessels, your kidneys also play a significant role in controlling blood pressure. Most people don't realize that the kidneys are also essential for red blood cell production. They release a hormone called erythropoietin, which tells your bone marrow to produce more red blood cells. Without enough of this hormone, your body produces fewer red blood cells, leading to fatigue and weakness. Even vitamin D, whether it comes from sunlight or food, cannot function properly until your kidneys activate it. This active form of vitamin D is what helps your body absorb calcium and keep your bones strong. When your kidneys are in trouble, all of these vital processes become disrupted, and the effects ripple throughout your entire body. The biggest problem is that early-stage kidney disease is almost always silent. You might feel completely fine until the damage is already severe. Studies show that by the time most people are finally diagnosed, they have already lost about 80% of their kidney function. That means the kidneys are already struggling to do their job. But here is the good news. If you pay close attention to the early warning signs, you can catch the problem before it becomes too late. The first warning sign is blood in your urine. Normally, we urinate about 6 to 10 times per day. If you suddenly start going much more often or far less often, or if you find yourself waking up multiple times during the night just to use the bathroom, it's a red flag. Feeling an urgent need to urinate but struggling to do so, or experiencing pain or burning while peeing, could signal kidney stones moving through your urinary tract. Seeing visible blood in your urine is even more concerning, as it may point to a kidney infection, a tumor, kidney stones, or even kidney failure. When your kidneys are not filtering properly, blood cells can leak into the urine. If your urine turns reddish, brownish, or purplish, women might sometimes mistake it for a delayed period. But it's important to recognize this as a possible kidney warning sign. Even if your urine looks foamy or bubbly, that is another signal of trouble. Frothy urine often means protein is leaking out of the blood into the urine. Normally, proteins such as albumin stay in the bloodstream to maintain health, but when the kidney's filtering system is damaged, these proteins spill over. Interestingly, albumin is the same protein found in eggs, which explains why the foam resembles beaten egg whites. Since urine is the main product of the kidneys, any change in its color, texture, or frequency should never be ignored. The second warning sign is constant fatigue. Healthy kidneys filter waste out of your blood, keeping your body clean and balanced. But when they struggle, toxins build up, and you begin to feel unusually tired, weak, lightheaded, or mentally foggy. Because your kidneys also produce erythropoietin to stimulate red blood cell production, kidney disease often leads to fewer red blood cells. This means less oxygen is delivered throughout your body, and without oxygen, your cells cannot produce enough energy. This explains why even after a full night's rest, you might still wake up feeling completely drained. This kind of fatigue is different from being tired after a long day. It can be so overwhelming that even simple tasks like showering or walking across a room feel exhausting. Doctors call this condition anemia caused by chronic kidney disease. The worse the anemia becomes, the more severe your fatigue will feel. Of course, fatigue can be linked to many other conditions such as thyroid problems, depression, or vitamin deficiencies, but if you experience persistent tiredness, it is important to check your kidney function with a simple blood test. The third warning sign is unusual swelling. If you notice your ankles, feet, or even the area around your eyes becoming puffy, especially in the morning, don't brush it off. When your kidneys are not filtering properly, fluid starts to accumulate in the body instead of being excreted. This fluid retention leads to swelling, also known as edema. Because gravity pulls fluids downward, swelling is often seen in the legs, ankles, and feet, but it can also appear in the hands or face. Sodium levels can also rise when the kidneys are weak, which makes water retention worse. In addition, when protein levels drop, especially albumin, swelling becomes more pronounced because albumin helps keep fluid inside your blood vessels rather than leaking into surrounding tissues. It's worth noting that swelling can also be caused by other conditions like heart failure, liver disease, or venous insufficiency. However, when swelling is persistent or occurs along with other symptoms, it should be seen as a major warning sign that your kidneys might be struggling. The fourth warning sign is shortness of breath. Many people assume that breathing difficulties are always linked to the heart or lungs. But weak kidneys can play a role as well. When the kidneys can't remove extra fluid, that fluid can back up into the lungs, making it harder to breathe. In addition, fewer red blood cells from kidney disease mean less oxygen in your blood, which creates that suffocating feeling. In severe cases, even lying flat on your back can make you feel like you are being crushed. If you are experiencing shortness of breath, especially if it comes on suddenly or feels worse when lying down, you should see a doctor immediately, as it could indicate advanced kidney failure or fluid overload in the lungs. The fifth warning sign is dry and itchy skin. One of the kidney's main responsibilities is to remove waste and balance minerals in your blood. When they fall behind, toxins begin to accumulate, and this buildup often shows up in the skin. Your skin may become dry, rough, or intensely itchy. Because the kidneys also play a role in maintaining the balance of minerals that support strong bones, problems in the kidneys often affect your skin as well. Some people may only experience mild localized itching, but when it spreads across multiple areas, or when the skin begins to take on a yellowish or brownish tone, it becomes a serious red flag. In fact, about 10% of kidney disease cases are first discovered because of skin-related symptoms. If you have tried creams, lotions, or treatments and nothing seems to relieve your skin issues, it may be time to look deeper. Your kidneys could be the underlying cause. A metallic taste in your mouth and foul breath are the sixth warning symptom. In addition to complaining that their food tastes odd or metallic, people with kidney difficulties may also remark that their breath smells bad, almost like ammonia. This occurs when the kidneys are unable to adequately filter out urea, which causes it to accumulate in the circulation. In addition to changing your perception of taste and making food unappetizing, that uremic accumulation can also result in nausea, appetite loss, and in more extreme situations, vomiting. Don't disregard these changes in taste or scent if you observe them. They are powerful indicators that you need medical help since your body is overburdened with pollutants. The seventh warning sign is trouble sleeping. When your kidneys aren't filtering waste efficiently, toxins remain in the bloodstream, interfering with your body's natural ability to rest and recover at night. This can cause insomnia or frequent waking, leaving you exhausted during the day. In more serious cases, poor kidney function can contribute to sleep apnea, a condition where you repeatedly stop breathing during sleep. People with sleep apnea often snore loudly, wake up gasping for air, or feel chronically tired despite spending enough time in bed. Unfortunately, lack of sleep also worsens kidney disease, creating a vicious cycle of declining health. The eighth warning sign is linked to high blood pressure and diabetes. While these aren't symptoms by themselves, they are the two biggest risk factors for kidney damage. Around 40% of kidney failure cases are caused by high blood pressure, and 1 in 3 people with diabetes will eventually develop kidney disease. High blood sugar damages the tiny blood vessels inside the kidneys, while high blood pressure puts enormous strain on these fragile filters. Over time, the kidneys become scarred and weak. To make matters worse, once the kidneys are damaged, they raise blood pressure even further, creating a dangerous cycle that accelerates kidney failure. If you truly want to keep your kidneys healthy, here are a few important tips. First, stay hydrated. Dehydration is one of the leading causes of kidney stones and kidney infections. Drinking enough water helps the kidneys flush out toxins and prevent stone formation. Aim for at least 4 to 6 glasses of water a day, but adjust depending on your activity level and climate. Interestingly, some studies suggest that drinking warm or hot water may provide additional benefits. For example, one study found that drinking 1 liter of hot water within 30 minutes reduced creatinine levels by up to 20% and urea levels by up to 40%. Second, be careful with medications. Over-the-counter painkillers like ibuprofen and naproxen, which belong to the class of NSAIDs, can cause serious kidney damage if taken frequently or in high doses. Even certain antibiotics can be harmful to the kidneys, especially if you already have kidney concerns. Always check with your doctor before taking strong medications such as penicillin, sulfonamides, or aminoglycosides. Protecting your kidneys means being mindful of what medicines you put into your body. Third, incorporate physical activity into your everyday schedule. Not only can exercise help your heart, lungs, and muscles, but it also improves blood circulation, lowers blood pressure, and lowers blood sugar levels, all of which support kidney function. Over time, even small exercises like swimming, cycling, walking, or light jogging can have a significant impact. Additionally, it is advisable to have your kidney function evaluated on a regular basis if you are over 60, were born underweight, or have a family history of renal or heart illness. Your kidneys are your body's natural detox powerhouse. Yet most people only realize how important they are when it is already too late. Once major damage sets in, recovery becomes incredibly difficult, if not impossible. That is why recognizing these early warning signs and making small lifestyle changes today can protect you from life-threatening complications in the future. So take care of your kidneys, stay mindful of the symptoms we discussed, and remember, prevention is always easier than treatment.